Hi, everybody. This is the January 23 VTC Wilderness Medicine Journal Club series. Topic this month is winter sports injuries in the backcountry. This is the first session of this next upcoming series from January through June. I will be giving out the FOM certificates soon. I just need to compile them and working on a lot of stuff this month, so please be patient. Some changes this series is that I'm going to turn over some of the work to our fellows this year. So we have 3 fellows and we're going to kind of cycle through them. So this month we're having Greg Fisher, one of our EM fellows in wilderness medicine, and Shay Strauss, EM resident at Brown University, joining us for running this session. So I'm going to kind of hand things off and they're going to be running it. I'll be in the background, but take it away. Thank you.
All right. Hi, everybody. Greetings from beautiful and now snowy West Virginia. I'm Greg. It's nice to meet everybody. I guess, Shay, for the sake of snow talk, you should say where you are too, because you're in a cool spot.
I'm Shay. I'm from Brown. I'm in Lake Tahoe, which is where I grew up. So I'm back here for the time being.
Yeah, it's got some good snow in her backyard right now.
Yeah.
So we kind of make the assumption that everybody has a little bit of different experience talking about both avalanches, but just snow in general and their understanding. So for the sake of acknowledging that people are coming from different perspectives, we're just going to talk about a little bit about snow. I'm going to kind of give some introduction and then we'll kind of get into the article. So the first thing that we want to talk about is the concept of snow being a complex system. So if we think about within a snowpack, snow may exist in many different forms. So we have lots of different types of snow. There's avalanche courses, and apparently you can get your PhD in snow. So it's very complex, and it's not something that just falls from the sky and exists on the ground in one form. So the snowpack can change. And snow may exist in many different stages on a spectrum from gaseous. Water can be kind of liquid and solid. And there's lots of different factors that kind of influence how the snow is forming and the pack is forming and how unstable it might be. So we think about things like the microclimates, the position you are on the mountain, different freeze-thaw cycles, surrounding temperatures, things like winds. We're seeing that right now in West Virginia with a ton of wind pushing the snow around and how that might change things. And then we are also talking about avalanches. So it's pertinent to kind of talk about where avalanches happen, but it's primarily a West Coast thing, but they do certainly happen on the East Coast as well. But the most common states for avalanche fatalities are in Colorado, Utah, and in Montana. Does anybody have any kind of questions or thoughts about the idea of avalanche as being a complex system, or things that they kind of want to talk about as like an overview of how to understand about basic things about snowpack? Okay, yeah, I think we're going to kind of get deeper into things a little bit later, but just kind of for the sake of moving things on and then tying things kind of back into the article. So a little bit about the pathophysiology, about how people are injured and type of comorbidities, I should say morbidities that happen from avalanche burial. So we are thinking of avalanche burial as being kind of a combination of asphyxia, trauma, and then kind of down the line hypothermia. So asphyxia is mostly related to the kind of position of the airway in the snowpack. If we think of something like a complete burial where your entire airway is underneath a lot of snow, very, very different and carries a very different kind of prognosis than a partial burial would. About 90% of burial victims survive if they're recovered in less than 18 minutes, and that kind of sharply declines after, and we'll get into that later. But we know that's directly related to asphyxia. So longer survival under deep pockets of snow is going to require an air pocket to form. And so we're going to also kind of get into some of the nuanced gear that's involved with avalanches, things like an airbag system that kind of can help create this air pocket. And then when we think about other kind of injuries that people who are surviving avalanches may be kind of experiencing. We're thinking things like orthopedic injuries, skin and soft tissue injuries, chest injury, abdominal injuries, and craniofacial injuries. In terms of trauma, we're talking about the trauma that's related to the primarily blunt force trauma that happens when you're impacting things as you're kind of tumbling in the avalanche, whether it's the really hard snow and ice that's forming in the avalanche, or you're encountering things like trees or rocks. And that's going to primarily be blunt trauma. There are some case reports of penetrating trauma as well. So when Shay and I were trying to decide how we're going to pick this topic, we were talking about outdoor sports because there's been a really big kind of uptick in, yeah, absolutely. Been a really big uptick in the in like outdoor people kind of recreating outdoors, especially during COVID. And so there's been lots of different statistical data that's been accumulated over the past few years. But if you look at ski resorts kind of across the United States, like the amount of skiers that are encountered during their ski season over the past 3 years has sharply increased. And that's kind of been a trend that's been continuing from the beginning of the 2000s. But that's kind of juxtaposed against the amount of skiing days that are happening across the country too. So as climate change is kind of happening, we know that our skiing seasons, especially in places out west, are a lot shorter. And so what we think is happening is a combination of people having, we're having more people who are recreating and maybe having less experience. And then we're having more people who are trying to get away from the crowds. And then also Shay was kind of filling us in about a little bit about the quality of the snow. So that obviously changes from year to year. And last year when there was a bunch of avalanche deaths, there was there's a kind of a unique kind of experience with the snow, and that the snowpack was especially more prone to sliding. So does anybody have any questions based off some of those kind of things? I know we touched on the big things, but specifically really big takeaways that we want people to be thinking about is the idea of morbidity and especially mortality coming from asphyxia and from traumatic injuries and avalanche burials.
Any questions before we move on?
Okay, cool.
We also
Okay,
kind of,
okay.
oh yeah, sorry, to get a background from you guys and see like how many of you guys are skiers or snowboarders, and how many of you have experienced either being in the backcountry or on mountain skiing or snowboarding, to see like how we can tailor this towards your experience as well. So I don't know if you're welcome to shout it out or add it to the chat, and that'll just help us.
All right, Brian, I'm going to call you out because I saw you raise your hand. So if you could either speak or talk to us about your experience, and welcome.
Yay,
Hey, yeah, thanks for having me. Hey, Shay. Me and Shay are co-residents. So
yeah.
I grew up skiing, so I haven't in the last like 5 to 7 years, but kind of since I was 4 all the way up till, my like late 20s. So just have a lot of experience on the East Coast, so maybe not as much of a like avalanche risk, but certainly did like a lot of adventurous skiing when I was younger, and maybe more like didn't care as much about accidents. So certainly put myself in retrospect in some like pretty sketchy situations with like very little education surrounding that. And like maybe that's the environment on the East Coast where avalanche isn't like so much of a big concern versus West Coast. So it's really neat to like see that, to read that paper this week and like get more information about it.
I can super relate to that, Brian. I also skied lots of sketchy things when I was younger. I think that's just being young.
Yeah, it's fair. But that paper went over that, so yeah. It makes me want to educate them. So sure.
I know, that's why I did this.
Can somebody explain why they think hypothermia causes such few mortalities with avalanche burial?
You have to be alive for a really long time to get hypothermic.
Yeah, it takes a while.
So I think people probably, so I think you have to have not sustained significant traumatic injuries and have a large enough air bubble to get to that point.
And snow's a great insulator. Like if you go snow camping, you can build like igloos and stay really warm within like a snow pocket. So despite it being cold, it can really insulate you from exposure. So if you are buried with a good air pocket, that's not usually the time that you get hypothermia.
Yeah, they teach like packaging and burrito wraps and stuff to ski patrols, or at least they should. One of our current faculty members does ski patrol, could probably weigh in, but there's been case reports of rescues from avalanche burials where they are not taught much about hypothermia, and then after there are deaths because they get the patient out as fast as they can, but then they don't deal with the hypothermia that exists. So definitely keep it in mind, but it is not as much of a mortality risk factor until after you get them out.
Yeah, once they're exposed to the elements, and then you're keeping them still as you try and get them to like a definitive management.
You can say if you want.
Awesome. Thank you guys for adding into the chat as well.
Yeah. So I'm just kind of want to talk about a little bit. So Nick Wright is talking about growing up kind of on the East Coast and skiing a couple times out on the West Coast. That's how a lot of people who seem to be out here are kind of having those experiences, right? So especially people on the East Coast, like we don't hear about avalanches in the news, but Justin and I were actually just on avalanche.org kind of looking at some statistics, and there have also already been multiple fatalities this year. So yeah, all on the West Coast.
And last year there was a big avalanche actually out of Tuckerman's Ravine and ski patrol out there, and it did bury people who were able to get rescued. So it does happen. There's 2 places in the Adirondacks in New York and in Tuckerman's Ravine, and we'll get to the reasons why avalanches happen. But just because you're on the East Coast doesn't mean that you can be like, oh, I don't need a beacon, I don't need to think about avalanches. There's more and more avalanche terrain as deforestation and climate changes like what is above the tree line.
Mm-hmm. Right. Cool. And so a really important concept that Shay and I wanted to talk to you about is specifically related to the amount of time you're buried in the avalanche versus your probability of survival. So does anybody in the audience have an idea about what that time frame is looking like? So for example, we'll say like time in minutes. So where are we looking at where your chances drop below 50% of survival? So, more than likely you're going to die if you're buried for over this amount of time. Does anybody have any kind of guesses who hasn't seen some of this data? Right, so Nick and Deb are thinking around 20 minutes. Any other thoughts? Yeah. I mean, so that's exactly right on, right? So, all right, 15, 20 minutes. So it really declines precipitously. So within the first 5 to 10 minutes, really surprisingly, really good survival data. But when the farther we're kind of going out along that timeline, it's really, really dropping off. And that's so much so that we're kind of thinking, really beyond, 120 minutes, like 2 hours, the chances of surviving gets to like really close to 0. And even at 30 minutes drops, pretty significantly to 25%. So having things like beacons and probes and things that Shay's going to talk about a little bit more, and we're going to get into the papers, it's just so important, because we know that the amount of time that we have like our ability to breathe and pour snow and make sure that we're not forming ice around our airways it can happen really rapidly. And so having some familiarity with this stuff is important, and it's a really important thing to educate people who are backcountry skiers on as well. So I think that kind of nicely goes into talking about the paper itself. And so we're going to let Shay take this over. And I think the way that we're going to do this is Shay's going to kind of talk about the paper itself. And then we're going to wait till the end to ask some questions to the group. And then we'll let you guys ask us some questions, and we'll have some points of discussion.
So this paper is adding to a body of literature that has done very similar studies, and these studies are convenience surveys. And so they talk about, and we'll get to the limitations of that, but their main question is, we know there's certain risk modifying things that people can do to reduce the risk in hazardous environments. And for backcountry skiing, that is carrying a beacon, probe, shovel, having a companion who has avalanche training, and for the person who is out there having avalanche training as well. And they wanted to ask people who were leaving a ski resort, so they had gone up the resort and were entering gates from that resort into the backcountry, which would be otherwise like out of bound, but on this at Jackson Hole, you're like allowed to leave out of bounds. And so they surveyed based on convenience, based on the days that surveyors were allowed to be there, how many people they had participate, and the answers to the simple questions that they asked. And they talked about the reason why they did that. And out of the number of people who skied through those gates, they don't really know the total number, but they were able to survey 334 participants, and they limited their questions to carrying avalanche gear, whether they were with a companion, if they had any avalanche training, and their age and their perceived experience level of skiing. And they kept it simple to increase the participation amount, and that they talked about some of the limitations, which we'll get to. And so we already kind of went over the introduction and background of this paper. Greg already covered those points. Does anyone have any questions about anything they talked about in the intro or background? Okay. So the methods, it was a convenience sample, like I mentioned, at Jackson Hole, so one location, and they used a type of statistical analysis called the Fisher exact test. And this is very good for small sample sizes, and you can also use it for large sample sizes, but it's when you're trying to find a correlation between two factors. So does age and experience level correlate, or like does age and this correlate? And that's why in the paper they have these graphs that are correlating two different things. So that is the type of statistical analysis that they did. So out of the 334 participants they surveyed, they had pretty much all of their responses except for 8 people who didn't complete all of the responses. The age categories were 14% were 18 to 24 years old, and they didn't include anyone under the age of 18, and they didn't stratify their age after the age of 35, which they did note as limitations. And then there was 26 were 25 to 30, sorry, and then 17 were 30 to 35, and 43% were 35 years or older. And 66% were male or in male only groups, and 3% were individual females or in female only groups, and 31% were mixed sex groups, so males and females in a group. And then on expertise, 21% rated themselves as novice, 18% rated themselves as intermediate, and 61% rated themselves as experts. But they didn't note in this paper what they would classify as a novice, intermediate, or expert, nor did they give the participants definitions of that. So if you think about yourself and you're like, how would I rate myself as a intermediate, novice, intermediate, or expert? Like, where on the ski resort would I say like I would transition from novice to intermediate or intermediate to expert? It can vary, and it can vary between resorts. So you could maybe ski one resort and ski everything, and then ski another resort and ski only 10%. And so it really depends on like where you are. But Jackson Hole is a resort that is leans towards expertise level. So like their black diamonds are true black diamonds, versus like in Rhode Island, we have like Yawgoo Mountain, which any of their black diamonds are really just greens. So if you're basing yourself as an expert based on your experience at this one resort at Jackson Hole, that is like unique to this area, which I think also informs their results. And then 66% of them were local residents, 34% of them were visiting, and 75% of them had participated in avalanche courses, and 25% had not. And then for carrying gear, they said that 295 or 88% reported carrying beacons, 87% reported covering shovels, and 86% reported carrying probes. And 85% of them had companions, and 50% of them reported having a planned route back. And so then when they looked at how these correlated with each other, they found that younger participants were more likely to carry standard safety equipment, and they didn't demonstrate like a clear pattern of age influencing whether or not someone carried equipment. But they said that that was kind of limited by not stratifying for over the age of 35. And they didn't mention not including people under the age of 18. But I think that that is also another group that, like, from anecdotal evidence, is also less likely to carry gear. And then for companionship, they found that in other studies, or sorry, not companionship, for whether or not they carried beacons, there were a bunch of other studies in the past that had done these questionnaires at various other locations in America, and found that there was a very low proportion of people who were skiing out of bounds, like off of a ski resort, who carried beacons. But in the backcountry, it's usually 90%, 98% of backcountry skiers carry beacons. So it definitely depends on where you start. Like if you rode the lifts up and you're going to ski out of bounds, how prepared were you to do that before you left home is a different question that you're asking yourself than like, I'm planning on going backcountry skiing. How prepared am I going to be to do that? And so, like you would imagine with those different questions that you're asking yourself, 98% of people who go and plan a backcountry route are carrying beacons. And they had 88% of their responders carrying beacons. Jackson Hole is unique in that it allows people to go out of bounds, and not many resorts do that. And so I think with that, there is like a different culture there that encourages thinking about out of bounds as backcountry skiing. And so people are asking themselves different questions when they leave home than people who ski at resorts who would otherwise like pull your pass for skiing out of bounds. Those are not, there's no culture there to think of that as skiing in avalanche terrain or as like a backcountry ski event. It's more like, I'm leaving the ski resort to go ski this powder and I was safe at the ski resort. There go, I should be safe on these out of bounds areas. So even though that's like an inaccurate assumption, it makes sense that someone would come to that conclusion if they were leaving the resort. And so they mentioned that that's like a discrepancy between their population and others. And then they also found that they were interested in why more experienced backcountry skiers weren't with companions, whereas less experienced skiers were with companions. And they were wondering if this was because of their concern that other skiers increase the risk of avalanches. Like if you're skiing with someone else, they can trigger an avalanche and you can be caught in that. Or if this like skiing without a companion is actually correlated with more risky behavior, like conduct. And they weren't able to conclude either of those things from this study due to the limitations. But I think one of the questions they didn't ask or talk about in this part of the paper is when you're less experienced, you're more likely to go with a companion because you're not going to come up with that idea on your own. But if you're with a group and someone's like, oh, let's go ski out of bounds, you're going to be like, oh yeah, I'll go ski with you. Like, I trust you, my friend, or I don't know these routes, but I'll go ski with you because you know these routes. You just feel safer in numbers when you are less experienced or you don't know the terrain. And when you're experienced and maybe you ski that area all the time, you know where your risk points are. And so you feel more comfortable getting out of that terrain on your own. And you're like familiar with the geography and also the risks. So I think they're not really getting into the nuance of what does that expertise mean for like this specific skier, and why companionship is a safety component when you're in the backcountry or when you're doing long pursuits away from like safety areas. But this being a out of bounds aspect of like a ski resort, you are very close to ski patrol and you're very close to like other resources. So I can see why they would have like a higher rate of older skiers who are very experienced skiing independently in that area. And then they showed that no group demonstrated 100% compliance with all of the things that are recommended. And they think that part of that is because of the cost of equipment, which has been studied in other publications. They didn't specifically ask that question in this one. And they were recommending that like we continue to assess the barriers for full compliance with safety recommendations. And we'll talk about that more as we go in this presentation, but that is one of the things that we wanted to also address is there's a lot of barriers to entry into any backcountry exploration, whether it's in the snow or backpacking or, anything that you're going to do where you are in a remote location. And those barriers to entry make it difficult for people to do it safely and make it difficult for, can be really intimidating for people who do want to enter and like have a good time. And so one of our goals today was also to sort of break down those barriers and help us all like have a better understanding of communicating that with other people and helping people get what they need to go adventure outside safely. And so I think they are very honest and transparent about their study limitations, which is awesome. They had many of them, but it doesn't make this study not worth completing. It does give us some valuable information, and it does demonstrate how this population of skiers and snowboarders behave. And that is really helpful to understand how the culture of a place and the way that people are participating in this activity at that location changes their behavior. And oh, go ahead.
Oh, no, people.
Okay, sorry. The main limitation that I saw is that they didn't have a way of recording how many people went into the backcountry, went out of bounds from these gates. And I think that would have actually been the most important thing that they could have recorded, because it's easy enough to like put a thing on a gate where people like go through and it counts how many people there are. And that would have also given them an understanding of like what percentage of people at this resort are doing this. And they definitely had limitations based on like who was there when they had someone surveying and who was willing to participate, and that they didn't stratify over the age of 35. But I think that the biggest limitation of their study is just not like having for that entire season, like how many people went out of bounds. They didn't really ask a lot of questions about other devices such as airbags or Avialong. And that was also because they were not as prevalent then in 2016 as they are today. So I think that it would have been like whether or not people were utilizing them then was so limited to like their access to them and like how expensive they were at that time. And so I think these other things that had been around for a longer period of time were more appropriate to study. So I don't think that this is actually like that big of a limitation of this study. And they are they talk a lot about, when we are when we're in the backcountry, we are often like planning based on avalanche forecasting, and they didn't ask anything about if they had done any forecast, like looked at any forecasts for that day. When they asked about their plan out, they just asked about a route out, but they didn't ask them like if they had used any specific like mapping equipment or if they had looked at the avalanche risks for those days, nor did they correlate the behaviors of people to forecasted avalanche risks. So people may behave differently on days that are low or avalanche risk. So they could have surveyed people who weren't carrying gear or skiing independently on low avalanche risk days. And when they surveyed people who had all of their gear and were in groups, it could have been higher avalanche risk days, but they didn't correlate that data. So that is like an external influencer of people's behavior, but they didn't know whether or not they had like looked into the avalanche risk or if that had like influenced their behavior.
And specifically, they did not include moderate or high risk avalanche days, right? So these were right. And so that I think that would certainly, you would have to think it would change people's behavior, right? And so to my knowledge, there has not been. I kind of wanted to know from Shay, from your perspective, are you aware of, has there been anything kind of retrospectively done to look at when they have these deadly slides, what the avalanche risk was? I mean, are these things that are happening that are killing a lot of people on, like, are people still dying on low or moderate risk avalanche days, or is this primarily when it's a really high risk?
Yeah, so actually the most common avalanches happen in moderate risk. And when I don't know if I could share my screen with the Sierra Avalanche Center. So there's an avalanche center for most locations, and you can see, let me see if I share this screen. Are you able to see the okay, perfect. So you can see where I am in Tahoe right now, it's low, and it's rarely ever low, except for like in the summer, and when like we have had just the sun baking down the snow for like a week without new powder. So all of the layers, there wasn't any dangerous layers that we had to be concerned about in the past, like dumps. All of them were really well cemented together. And so the risk actually this season has been moderate in Tahoe until today, and then it dropped to low. There's also no powder out there, so like nobody is going backcountry skiing right now. But the highest risk time is in moderate. I think what they meant was considerable and high, because considerable and moderate is like the most common. It's like Jackson Hole's never actually out of moderate usually, and Colorado is usually always never gets really below considerable unless they're like not really getting enough snow. And so I think when they said that, when they were giving like those risk factors, I think what they meant was considerable and high and extreme, because if it was moderate, it would have, it didn't make a lot of sense to me. But we have the most deaths in moderate.
Right, and I think that just goes to show you that maybe even if some of the more expert people were saying that they were not carrying some of their safety equipment because of the perceived lesser risk, because it was a moderate or risk day, or even below that, but that's kind of like faulty logic if you're only carrying it on days where it's a higher risk, given the fact like what we actually know about some data from avalanches.
Totally. Yeah, I agree.
So I guess kind of at this point, I'm kind of curious to know about, from the group's perspective, do you guys specifically have any questions that you would, or topics that you kind of want to discuss based off the study itself? Shay and I have some other things that we want to bring up, but I think it's a good time to kind of open it up to the group, so we can kind of discuss things too.
Sounds like you guys are going to talk about it later, but that was something else I picked up out of the article, was like, and I ended up reading I think the recommendations from the Wilderness Medical Society as well. And I think both touch on the fact that the gear can be quite expensive to like outfit completely. So I wonder, because like the study seemed like it was kind of like almost like hypothesis driven, or like driving paper. So I just wonder if there's been any interventions at that location to like maybe do rental equipment, or somehow like, or any kind of national kind of endeavor to talk about how we get like equipment to be cheaper. I don't know if that's like the gold and silver bullet or whatever, because there's also like training that goes into it as well. And if that's lacking, then having the equipment doesn't necessarily like meet all those. But it sounds like you guys are going to talk about it. But I thought that was a really interesting point in the paper.
Yeah, and I'm glad that they mentioned it, because it's actually the thing that I think overlaps the most with social emergency medicine, where like we want people to do the thing that would be the most protective, or they're like manage their risks, but they're so expensive, or like you need knowledge, or there's these barriers to care, there's these barriers to like doing things safely. And so I agree. I think that is sort of the future of wilderness medicine, and is like advocating for lower cost education and gear, that safety gear. To my knowledge, nobody, like this group hasn't specifically done anything or studied any interventions to that point, but there are some places that you can rent avalanche gear, and there is one in the Tetons, and that does help decrease risk. And even if all you know is how to turn on your beacon, if you are out in the backcountry and there's other people who know how to find you, if you have a beacon on, that's like better than not having a beacon, even though we want you to do all the things. It's sort of like, how can we do harm reduction almost with some of these things? So part of, I think, the future of wilderness medicine is advocating for lower cost access.
Right, and just going into being like furthermore, kind of Brian, what you were talking about is being able to direct the interventions that we're making to the specific groups that are at the highest risks, right? So how we can kind of reach those maybe expert level people that might be a little bit more or a little bit less likely to maybe take some of these courses because presumably they have some experience. And then taking these limited resources and then spreading them out to some of these more novice people who are like, hey, you might have some of the gear, but maybe you're less likely to know how to use it, or maybe your companion that's with you is less likely to know how to use your gear, and some of the pitfalls that that kind of entails as well. Awesome. Any other thoughts from the group? Specifically questions? I guess if nobody has anything to offer, I just want to know what people kind of think about the way they selected like the methods of this paper too, and if they thought that in terms of introducing kind of bias, Shay talked about it a little bit, but just wanted to hear people's thoughts on the methods of the paper.
Oh, and Zach asked if there is avalanche risk posted all over the resort, like when you leave the backcountry. Jackson Hole is unique where they do let you go out of bounds, and they do post that leaving out of bounds does have avalanche risk, but avalanche risk changes every day. And so they don't have real-time updates. They just tell you that there is an avalanche risk. And so it's up to you to like look on the Teton avalanche site and make sure that you are like knowing what your risk levels are and the different layers of snow and how that could like affect your risk at different angles. So they don't post that specifically. And yeah, I think the methods of this, one of the things that I thought about is in terms of methods is we do a lot of surveys with people with these groups of outdoor recreationalists, and we don't compare that to data that we could get from how many people like bought backcountry skis or how many people entered the backcountry from like a gate that could like count the numbers, and like comparing this data with more objective forms. I think that is the biggest limitation in a lot of our understanding of the number of people who are going outside and the risks that they're facing, is that we're basing a lot of our understanding on these survey methods, but there's other indirect ways to identify like who is participating in sports that aren't always included in these studies. And I think that's harder maybe to gather, but in some ways almost easier, because you could find out like how much of these bindings or these skis or these boots were sold this year in comparison to prior years, and have that as like another metric of people's interest in this certain type of activity. Right.
And just thinking about how they gathered the data too, just going back to like simple, review of evidence-based medicine. So they took things over the course of like February and March of 2016. So they're missing, a large majority of the season where people may have different practices, right? So that's something to consider. And then I think they tried to control. They did do some sampling at different days of the week, which was great. But again, they had it over a 3-hour period. And so I think they were probably dealing with some resource, these things cost money and take time and require volunteers. But again, just like thinking about the quality of input for the data that we're getting as we're making assumptions based off of it is important to consider.
Definitely. There are certain areas in the backcountry, like Tahoe has them, Utah, Colorado, and Wyoming, Montana will have certain areas where a lot of backcountry skiers go, and there's gates that you enter through where you can check your beacon. And so I think there's some low hanging fruit there where you like can actually like measure how many people go and how many people have a beacon that's on as they enter into the backcountry. And so I think that's another place where we could expand our data collection and see, again, you're limited by your location, but you are getting a little bit more data into like the percentage of people who are carrying things into the backcountry.
Absolutely.
I would say real quick too, this kind of like deviates off of the methods from this exact paper, but I think like this is a really good case of like maybe thinking about outside the bounds of like qualitative research and starting to think of like qualitative research or quantitative and thinking more of qualitative research. So like I think this would have been a really good paper to do like interviews with people. Like why are they only meeting 80% of their equipment goals? Or why did they choose to like come on their own? And actually like it would like humanize that a little bit more and also like give us a better direction on like how we intervene. Because right now we have these raw numbers, but we don't really know like what's driving the individuals to like do these practice patterns. But if we had involved some like qualitative research into it, which also takes up more time and resources, but it could have been like a more fleshed out understanding of like what's happening.
I agree. I totally agree with that. And I think that like there's value in accumulating this data that researchers have done in different locations in similar ways. And we run into this problem of like, it's great when you replicate similar types of studies because you can compare, like they did this type of study with this, it's a convenience sample and they used, this type of data analysis and they did a Fisher's exact test, and other publications have done that so they can compare against each other. And that's awesome. But I think it also opens up some questions like you're mentioning, Brian, that it's like, it would be great for us to then also add on to that and be like, okay, we did all these things, you compare us to these prior studies. And then we also interviewed people to like contribute to like future like data accumulation on how people's perspectives change over time.
Absolutely. So I think if there's no other questions or comments specifically from the group, I wanted to hear, Shay, your thoughts on a little bit about like the pop science kind of versus reality with the way that we're kind of consuming our knowledge about outdoor kind of recreation and safety. Shay and I had talked offline, had some really interesting thoughts, and I thought would be a great point of discussion.
I thought it was really interesting how everyone was talking about like during COVID, oh, there's all these people who are going outside and it's so much more than before. And there's all these new people like getting into backcountry skiing or mountain biking or all these things. And then when I was looking at there was a lot of publications in Outside Magazine talking about that. And then when I was looking at the numbers based on USDS or USFS, sorry, US Forest Service or the US Park Service, the numbers of people who had visited wasn't actually that much greater than like the year prior. And there's these fluctuations that go up and down, but like the numbers in 2020, 2021, 2022 weren't like statistically significantly different than the numbers that they had in the past 10 years. And so I think that it came from how our lives had changed in the sense that like you could go out on a Wednesday and see more people on Wednesday, but overall the number of people who were outside hadn't changed that much. And how we can think about how when we're using our resources and we are trying to encourage people to do healthy behaviors like get outside and exercise and things like that, that there are these knowledge barriers. And so it is kind of the same people who get exposure either through their friends or some new technology that allows them to adventure outside in safer ways or makes them more confident to do that. That has slowly increased the number of people going outside, but not in like dramatic numbers like Outside Magazine was saying. And a lot of what we learn through like our wilderness med training does correlate to, or does contribute, sorry, to us having conversations with our patients about like, it is safe for you to go outside, it's safe for you to adventure, and here's how you can do that, and here's how you can learn about that. Because as people do go outside and adventure outside, they tend to be more of stewards for land and tend to disseminate more of that safe knowledge amongst their peers and amongst people that they also get outside. So I think it, to me, was an inspiring point of don't get swayed by the pop numbers and think that there's like some tsunami of people going outside, and that like all we have to do is just like educate them and hide from them because we want to be in solitude outside. It's more like there really isn't that great of an increase in people who are going outside, and the proportion of people who are going outside with knowledge, like training through an avalanche course or NOLS or something, hasn't really like statistic like in the proportion of people hasn't changed that much. And we do have still a huge population of people who could benefit from being outside, and also are the perfect population to also give education to, because then they start from a place of education and exposure to the outside world with like the resources they need, and are more likely to bring their friends outside in safe ways with knowledge. So I think that that is one of the benefits of like reading papers like this is not a ton has really changed from 2016, but people's perception of what has changed is like pretty significant because of articles that just were so bombastic about like what was going on outdoors.
I wonder if the way that we're consuming our media, so like we were talking today, how you can go on YouTube and see people's GoPro footage of avalanche like recovery and things like that, but there's a lot more of GoPro videos and videos being uploaded to YouTube, kind of idolizing these people who are doing these really, really dangerous things that we that like lay people who are recreating outside. So like somebody who's going to Jackson Hole might be like, hey, I've only ever skied in bounds, but I'm seeing this, it's being idolized in our culture, and like I want to get and go in the backcountry. And I don't know how you would be able to kind of assess that. I think it would take a little bit of time, but like we certainly know that there are there's been people like who are interested in climbing now because they saw free solo, and now they're like, the expectation is, hey, like we'd like to push it. And I wonder how that's going to influence the community, even if the proportion doesn't necessarily get bigger, if people are willing to do more risky things.
Yeah, I thought that was really interesting too. And there was, so for example, I found this Outside Magazine article that was like, there's all these people dying in the backcountry because everyone's like going to the backcountry now. And then Colorado, which has like the most avalanche deaths and avalanches, it's always like a very high avalanche risk, didn't really show that. Like when I went on their website, it was like, it wasn't showing dramatic increases in the number of people dying in avalanches. And I think that we haven't done, I haven't seen any publications that asked younger people. I think the people most influenced by social media to go outside like ski resort bounds are probably in the like teen to young adult age group. And there hasn't really been a study that asked them like, did you make decisions today about what you were doing based on something you saw on social media? And I think we do know that like friends really influence friends, and a lot of the kids that get killed in avalanches get killed together. And we see that in Tahoe a lot, like they'll be skiing between resorts out of bounds, and they get caught in an avalanche, and they're usually somewhere between like 16 and 22. And so I think the influencers are definitely social, but there isn't really a study to quantify like how big of an influence seeing all these big skiers and riders has had on younger generations doing more dangerous things.
All right.
There's one nice thing to give us some hope about the safety practices of the upcoming backcountry generation is there was another study that we had debated using that was talking about the quote beginner backcountry skiers and their likelihood to have taken an AVI course of whatever level or backcountry ski course prior to actually getting in backcountry ski terrain. And the newer generation is more likely to have taken courses prior to getting out there, as opposed to like the older generation.
Yeah,
Who
and the
just
older
like, hey, I've done this since I was little, or like, hey, my dad taught me, and this is just always what we've done. So it is nice to see that our hope is that the culture is changing, and we can all help to further that. That the further the younger people get into it, and the newer people get into it, will have had training, and we just need to advocate the utility of that. And, so much of medicine is prevention, right? So
Yep.
hopefully we can prevent the rescue team having to go out because they've done AVI courses, they've planned their route, which we'll talk about in a second here, appropriately.
Yeah.
Yeah, and it's usually the more experienced skiers who die. And there was a recent study about that, and they still don't know why that is. And they're like, is it because they're doing more risky things? Is it because it's just an accumulation of days? I mean, it's like whether or not you're going to get bit by a shark surfing, it's like, do you surf every day? Then like your chance of encountering a shark is higher than if you only surfed once, right? But similar to like, are you going to get caught in an avalanche? It's like if you're backcountry skiing every day, your risk is higher because you're there every day. And we haven't really stratified for that. Like we don't ask the person who died, like, how many days did you ski this season? And there's no pass to like be able to be like, oh, they checked into the resort this many times. So we just don't know if it's like because they feel more comfortable in the backcountry and do more dangerous things, or if it's just sheer numbers.
Awesome.
And then you have to wonder about like expert halo recency bias, because a lot of these people will be like, I've skied this mountain since I was a kid, I'm good. And then the experienced people get taken out.
Yeah. And we actually had a really cool course in med school by a guy who's a backcountry skier about medical decision making and thinking about it from the perspective of backcountry skiing, which I think is another really interesting aspect of like just learning about this, even if you don't backcountry ski, is the decisions you make about risk are very similar when you're going to go do something, whether it's like deep sea diving or mountain biking or backcountry skiing, where you have risk involved, how you tolerate that risk and what you do to mitigate that risk is very similar to like the way that we think about risk in our medical decision making as well. And so I think it is empowering, at least for medical students and residents and doctors, to be like, I can use this skill even outside of the hospital in ways that can educate other people and also help me not die when I'm doing outdoor stuff. And yeah, sorry.
No, yeah, and like even furthermore is like when we're looking to make interventions, it's like specifically like how can we kind of get this this and think about the data a little bit differently to ask the questions like what you were saying, Brian, and like go into it like why are people making these decisions, because that's where we're going to be able to have the biggest influence on doing things that are more like preventative in terms of education, instead of hey let's get these people like it may be better to teach 100 people about how to not get into an avalanche than to teach 10 people how to dig your partner out of it, right? So it's like there's like that kind of concept behind it.
Definitely.
So I guess this kind of leads into the last thing. So if anybody has any questions at this point or other things they'd like to discuss, we're going to kind of take, we're going to talk about something else. So you can speak now or hold your peace until in the future, we'll talk about it. Okay. So I guess Shay, for you, I have a question. So like theoretically, so I'm a novice skier, right? So I don't have any experience, but I really want to learn about how to use things. Like I have a phone, it's got some charge, I can download apps, and I want to know how can I figure out what my avalanche risk is in an area, and is there something I can use? Like I don't see something on my Google Maps. So could you kind of walk me through that?
Yeah. So I think the easiest access point for everybody is avalancheforecast.com. And there's also an app for your phone from that. And avalancheforecast.com allows you to connect with any regional avalanche center. So like I showed the Sierra Avalanche Center, avalancheforecast.com, it shows an entire map and you can search through it to the area that you are, and it will give you the avalanche risk in that area. And that is one piece of information, like just seeing whether it's blue or yellow or red or orange or whatever. But you can click on that. And then when you go to the website, so I'll share my screen again. And this is the funnest part about taking an ARI course, which I highly recommend. But even if you're like, all I have time for is looking at this website and that's where I'm at, this is still really great. So you can click here for full avalanche forecast. And there's professional forecasters for each center and each of these regions, and they go out and they cut the snow and they analyze the snow and the snowpack layers, and they determine the risk of slide in areas that would be particularly dangerous. And when we think of what causes avalanches to occur, the two things that I think are the most important for anyone to know is avalanches occur above the tree line and at 30-degree angles or above. And so if you are in an area that doesn't have any trees, you're theoretically above the tree line, even if you're not like elevation wise above the tree line. It's like there's no trees, you don't have breaks for that snow. And so the snow will just go down in that area. And then if you're at a 30-degree angle slope or higher, it's a slope angle that will cause a large enough slide to bury you. Under 30 degrees, if you're in the trees under 30 degrees and you are not, like above you is not avalanche terrain, and you didn't traverse avalanche terrain to get there, then your avalanche risk is very low. In even high avalanche risk times in the backcountry, it's just hard to get to those locations without traversing avalanche terrain or without being underneath avalanche terrain, which is why they still recommend you do not go in the avalanche like terrain areas, which would be those whole swaths of land to get to those areas that are low avalanche risk, because you run the chance of being caught in avalanche on your way there. And so you can see above the tree line, near the tree line, and below the tree line, and they will have different gradients at different times. Let me pull up Colorado's because Colorado has a higher risk right now. No, that's not Colorado. So they have yellow and orange. And so if you go to orange, you'll see above the tree line is considerable, near the tree line is considerable, and below the tree line is moderate. And so this is all assuming a 30-degree slope or higher. So that's why they're giving you that information. And then they can say how you can trigger an avalanche, and it would be based on so when you're out there, if you have a compass, you could say like, oh, I'm north through east or to south facing slopes at upper elevations. And that would be like the place where I would be most likely to trigger an avalanche. And that is helpful information, but can still be quite overwhelming. And I think what's useful is just to kind of get a sense of like, where would I go if I wanted to know what my avalanche risk was, if I was to go off of a ski resort, or if I wanted to advise somebody, and it would be their local avalanche center. And from your phone, you could get to any of those on that app. And then to help them understand that anything above 30 degrees is avalanche risk, and anything where you don't have any trees is the highest avalanche risk. And to read this report and what kind of avalanche problems you would have. And they describe the types of problems. So their problems are actually, before we went into green, we were in yellow and orange as well. And we were also having wind slab problems. And that's where wind blows snow onto a stable layer, but the layer between the snow that's been blown and the stable layer is unstable. And the snow that has been blown will then get compacted just by like gravity and the sun. And so it will feel stable, but it can crack as temperatures change and not adhere to the layer underneath. And depending on the thickness of that wind slab can inform how severe your avalanche risk is. So when we were in yellow, we had like a foot of wind slab, which over a large swath of land could be a very considerable like avalanche risk. But over smaller pieces of land, it's like moderate because of just the accumulation of like the volume of snow that you would encounter by triggering a wind slab. And then this helps you understand the aspect elevation, helps you understand the areas that have the highest avalanche risk and where that is. So the gray is talking about the highest avalanche risk area. So if you were to look at a mountain with a compass, you would be able to say like, if I'm on the southwest facing slope versus the southeast facing slope, what is my avalanche risk and how does that change? Which type of route I want to take on this mountain to get to where I want to go and what I want to ski or snowboard.
So
And
what you just said about the sun exposure and the aspect of the mountain is very important. As is looking maybe at least a week prior to your estimated travel date to look at what the weather's been like upcoming. It's sort of like when you're planning a river rafting trip. You don't just care about today's weather, even though you want it to be sunny and awesome. You care about the rainfall for the past couple of days. You care about the current, you care about the flow, all sorts of stuff. For this, you want to know what the weather's been like recently to know what your base is and to know what the potential for an unstable weak layer is to cause a slide. So there's a lot to look out for. And also you see she's looking into I think the Front Range in Colorado. The weather patterns, the avalanche risk, the type of slides is very different depending on what part of the country you're in. So you might learn a lot about avalanche risk in Colorado. That's quite different from like Pacific Northwest, which is also very different, although it's kind of halfway between the two, of what's in like New Mexico. So that's very different. And just because you're really comfortable with one, you might be great at planning things, but you really got to look at the region you're going to as well. And that leads us into planning a trip, which is almost more important than everything else we've talked about.
definitely.
So, yeah, I guess the last thing that we wanted to talk about today is, so Shay has a ton of experience, and she's been a great resource for just like knowledge and backcountry skiing in general. But I thought it would be interesting because kind of along the vein of prevention. So we want to plan to not get an avalanche, right? So we can talk about it and carry our probes and beacons and things like that. But like the best way to survive an avalanche is to not be in one. And so we kind of wanted to pick her brain and see what her thoughts were. And like, if we're going to say, hey, how would you plan a trip and how can we use some of our technology that's available to share our trip so others may know where we are, and to so that you guys can see it as well.
Yeah, and so definitely the avalanche risk app is a free app and it's awesome. The other ones that I use are CalTopo and Gaia. And so in that resource document that I shared, those are two ways that you can start looking at maps. And also in the resources I put in where you can get a beacon and what kind of beacon and how to think about it and gear checklists for getting outside. But at the very top, because it's like the number one most important thing is getting education, and there's some online education. There's AIRI, which is the avalanche training courses, and they start with the just regular AIRI 1. Those can be expensive and it can be challenging to get to the location where they are. So if you don't have the opportunity to do that, there are some online avalanche training courses, which I wouldn't say would be equivalent to AIRI, but allow you to start understanding the language and understanding the thought process. So if you were talking to people about avalanches, you have a basis to go off of. And when you do take an AIRI course, you have more understanding and can get more out of it. And in New England, there's 2 places that offer AIRI courses and have avalanche risk and have very knowledgeable people in those areas that are more than happy to invite you into the community of people who are backcountry skiers and talk to you more about it. And that's in New York State at the Adirondacks. This is a new location. They just started in the last year. They're really on like a social encouragement of access to education and resources and all of the things that you need to safely travel outside. And so if you are wanting to get education or resources there, I think I would definitely direct you towards them. They're so very, very nice people and like very much dedicated to you getting what you need in ways that you can afford. And then Tuckerman's and the Mount Washington Avalanche Center is the OG avalanche area in New England, and was the first place where people went backcountry skiing. And so they have a lot of resources as well. And if you use a GPS watch, you can share your coordinates with whoever when you are like traveling anywhere, like whether it's in the backcountry or not. And that's always really helpful. But if you use Gaia or CalTopo, and I'm just trying to log into my CalTopo real quick so I can show you, you can plan routes and you get let me see if I can.
Does anybody in the audience have any experience kind of using these things while Shay's kind of pulling up the screen?
They're not just useful for backcountry skiing. I mean, I use them hiking. I use them for mountain biking.
Right, and not only is something great that about Gaia, I was just introduced to it within like the past year, and so it's got overlays, overlay maps, which are great, and a lot of this stuff is available for free, right? So it's not like you have to pay for some expensive subscription and for an app that you might not use. And I guess if you're on this this Zoom call right now, you probably have some interest in doing stuff outside. So I'm sure there's things that would be tailored to your interests, and it's definitely worth taking a look at.
Yeah, you can use it for any type of outdoor, like whether you're backpacking or mountain biking. They have like maps that have really, it's like topo maps that are really great quality. And even when I don't have cell service, it can still locate me based on GPS and like downloading the map, which is really awesome.
You can also plan your route, and you can have it show the avalanche risk shaded in on different shades of, red, green, yellow. And then you can download it, trace a plan of the route. And when you're on that trek, it'll show you where you are on that map. So you can follow where you're at on your planned route on your trip, which is really useful.
Yeah. And let me see, I'm trying to pull up my CalTopo. So there's a bunch of, if you search online even, you can get a bunch of CalTopo maps, which I found really interesting how they are so available, and they're like, you don't, I was looking actually for backcountry ski routes in New England, and there's people who like will post on Gaia and CalTopo backcountry ski routes. And let me see if I can show you one of the ones I found. So this was for Vermont, CalTopo, and let me see if I share my screen. Okay, so for Vermont, CalTopo, so you can see there's a bunch of people who have shared different routes that they have taken, and you can from that be like, oh, do I want to take this route or not? And you can see when you pull up the when you zoom in, you can see like where did they park, and then they went up this terrain, and that you can see the topo lines and the angles, which is really nice. And you can see other like features like water and summits, and then the layers that you're talking about is if you want to add let me see where my map layers are. You can do contours. I wanted the snow one, weather shading. Oh, avalanche. This is the one I want. Okay. And in Vermont, it's not going to be very great. Let's see if I can get to an area where it would be higher. Okay, so sorry, I zoomed a bunch. So here is our presidential range, and you can see here's our avalanche risk. And then from there, you can go to the Mount Washington Avalanche Center, which right now has a high avalanche danger. And so what is cool about it is like you can have these overlays and see like, where would I go skiing here? Where have other people gone skiing? And you can see some of the routes and the angled slopes and gradients based on weather or wind, avalanche risk, sun exposure. And that gives you ways of thinking about like, if I want to be on a southeast facing slope, what is my risk of avalanche? And I can go to this avalanche center and see, and then I know that my angle is over 30 degrees and I'm going to be in the sun with high wind. It helps you think about like, what are my risks for those different environmental conditions? And the ARI courses help you put all that together and think about like, okay, at what wind speeds and how much sun exposure, how is that going to like change the snow by the time I like wake up, get to the mountain, hike to my peak. Now it's had this much time under this much environmental stressors. Like, is the snow going to be where I planned like the day before or that morning? And I think that's the benefit of taking an area course, is you get more exposure with how to plan your trips, in addition to how do I actually use all these tools to get someone who's been buried out of the snow. And they're usually 2-day courses where they spend 1 day on planning routes and thinking about your risks and modifying your risks. And then the next day you're out digging up probes and finding beacons in the snow.
Awesome. Great. Well, Jess, were you gonna say something?
I was just gonna say, has anybody taken an ARI course and could share kind of how it went for them? Or what about backcountry ski course? All right, well, I highly recommend doing one or both.
Yeah, definitely.
Not only was it remarkably fun, and they're usually in really pretty areas. I did mine in Rocky Mountain National Park. The organization I did it through, we're talking about like financial barriers to training like this. The course I did got me like a 50% off deal at a condo to stay for the couple days. So they realize that it's expensive. They're usually really laid back, like ski guides. There's ways to find it somewhat affordable. And if you're worried about skiing, there are area courses that do snowshoes. So you can do snowshoe groups because it's hard to learn 2 things at once. So if you haven't backcountry skied, if they allow snowshoes, you can focus on the AVI training, then go do a backcountry ski course or one after the other. That way you're learning one thing at a time, because it's overload potential.
Yeah. And when we say ski, we also are including snowboarders. Sorry, that's like common vernacular. I think we always just like, because it's the shorter word to say. But you can definitely do it as a snowboarder. They are doing area courses now for people who ride snowmobiles, because that's actually the group that gets in the most catastrophic avalanches. They're super fast. They cover a ton of terrain, and they like go off of really dangerous terrain too. So I think it's really cool that they're expanding that. And the things that you learn in an area course are definitely translatable into mountain biking or backpacking, in this, not necessarily like the avalanche risk, but how to think about maps, how to plan a route, how to think about like the environment and the conditions, and what are your risk modifiers. And so even if you're like, I'm not that excited about avalanches, or I live somewhere where I don't ski a lot of avalanche terrain, you still pick up a ton of skills that are really valuable, and you get to do it in a really fun place. And everyone I did my area courses with, I'm still friends with and go backcountry skiing with. And so if you're new to backcountry skiing and you want to like meet people in the community, it's also an awesome way to do that and become a part of the community. And it can sometimes feel like very difficult to enter that community. I felt that way when I was growing up. It seemed very elitist. And then as soon as I took an area course, my first area course was when I was right out of high school. And I felt like people were very warm and welcoming, which was a very different experience than what I had experienced when I was on the outside.
Part of our hope was to act as a primer to backcountry planning and travel, leading you to learn more about the planning aspects, the risks, the potential, and the way to somewhat navigate that course. So we have done a prior session on avalanche rescue and avalanche specifically. That is a recording that's available. But does anybody have questions more deeply into avalanches themselves or avalanche rescue specifically?
And when you're skiing at a resort and you go off out of bounds, think about that you are now in avalanche territory, because ski resorts inherently pick very steep terrain. Most ski resorts have like their black diamonds are over 30-degree slopes. And so the chance that you're going to be in an over 30-degree slope above the tree line out of bounds at a ski resort is very high. And so if you do decide to travel, having an area course under your belt and being prepared with a companion and a beacon and a probe and a shovel is actually a good idea, even if it's not at Jackson, even if it's somewhere else.
And about 3% of all AVI rescues are called for avalanches that occur in bounds.
Yeah.
So it can happen. It's good to be prepared all the time. And it's just good to know your gear. Like I did my AVI 1 course 2 years ago. As an example, today, we were playing with probes. I had a brand new probe, took the tag off of it, took the strap out of my bag, used it for the first time ever. And after not using a probe for 2 years, and I took a couple tries to get it, the goal is to get it locked in one throw. And it just shows that you got to keep these skills up. Of course, they could advocate for continued training, but the ARI program recommends doing the AVI 1 course and then annually refreshing with an AVI rescue course, which is a day of just scenarios. So keep the skills fresh or you lose them.
Yeah. And it had been like a couple years since my ARI 1 and I hadn't done a refresher. And so I redid my ARI 1 recently, and the science is evolving and like the resources that we have available has changed so much. And the course was so different than when I had first taken it, just based on like what was different between like 2004 and then now 2020. So I think it's even if like you end up taking a course and then there's several years when you haven't been either using those skills or had taken a course and you weren't able to get in a refresher, there isn't anything like you shouldn't think about not taking another ARI 1. It's a really valuable course and it's super fun. And the ARI 2 and 3 and like pros the ARI 2 and then the pro ones are great if like you are trying to like go on a mission to become a guide, or you want to like as your career be involved in either one of the avalanche centers or backcountry medical direction in some way. But they are more into like the nuance of snow science and the mapping and stuff. So I think everything that you would need to just be a recreationalist is in the ARI 1.
Yeah, awesome. Cool. Well, again, thank you guys. We appreciate everybody signing on. Shay, thanks for your expertise in this area. As Justin kind of said before, we've got a couple of our other Virginia Tech Carillion fellows going to be leading some of our other discussions. And as always, we do encourage you guys to kind of stay involved, keep joining these and come with good questions, because as Brian kind of pointed out, they're opening some good discussions for us. So we thank you guys for your participation. And if you guys have any other questions, we'll hang out here for a minute or two so you can pick our brains. And if not, have a great night.
Yeah, like I said, I'll try and get these farm certificates out. Give me some leeway, but I'll get to it. I see some new names, so it's nice to see some new participants. The next month, our fellow Lydia is going to be leading our session on leave no trace practices, which is not only good for the environment, but it's also a very good safety recommendation. And we're going to be doing that on February 23rd, 7 p.m. US Eastern. So like Greg said, any questions or you want to join in, just kind of chat for a minute. Otherwise, the bulk of our session for this month is over. I'm going to end the recording.